Hi, Paul. Thank you so much for taking the time today. Excited to chat with you more about MD Revolution.
Sure. Yeah, I'm excited to talk to you today. We're excited about our partnership with Panda as well, with Panda Health. I am Paul Huffman, Chief Revenue Officer at MD Revolution, and been with MDR since 2019. Previously, I had my own CCM company that we started in the Chicago area, and we were acquired by MD Revolution in 2019, and then I have been on board since then.
Awesome. Great. My name is Neha. I'm the Director of Partnerships and Customer Success here at Panda Health. On that note, can you tell me a little bit more about what health systems are doing with respect to remote care and virtual care programs? Because we see that more of them are getting interested in it now and becoming, or at least becoming open to it. Why do you think that is?
Within health systems, we're seeing more innovation and even a lot of titles called, Chief Innovation Officer and looking how to implement some of these, quote unquote, newer digital programs within the ecosystem. So we're excited about being a partner.
That's awesome. We're looking forward to learning more about it.
I think the market is catching up with some of the innovation that happened when these codes first came out in 2015, and then in 2019, 2020, remote patient monitoring or monitoring vitals was now approved by Medicare as well. And health systems usually have a kind of wait and see approach to new programs, and at the time it was very novel, right? It was one of the first codes that you could bill without seeing the patient face to face in the office and actually physically in the office as well. And so there was a lot of hesitancy, I think, in the market, especially before COVID. And then we all and health systems were just ransacked with COVID and all the complications that came with that. But also then all innovation kind of got put on pause, right? The hospitals were really the backbone of the health system there for probably almost 3 to 4 years. And so we didn't see a lot of new initiatives start during that time. But I think what has happened is not only are patients more comfortable with virtual care and digital care and even telehealth and so are health systems, right? They had to implement it quickly and efficiently and effectively in order to treat their patients during the pandemic. So we're seeing now the dust settle from the pandemic, but also we have this residual effect where now health systems and patients want to jump into digital care or remote care and remote patient monitoring, chronic care management, and even some of the other services available like transitional care management can if not all or most of those services can be done remotely now. And so with that, there's a lot of questions, and now there's finally a lot of jumping into these services through health systems.
Yeah, that's exciting that now health systems are looking at things more than telemedicine and remote care monitoring and care coordination. Can you tell me a little bit more about how health systems can get started with these programs?
Yeah, I think one of the misconceptions that we see is health systems always want a pilot, or they want to dip their toes into it a little bit. And it's an interesting conversation when we're first either starting with a new client or about ready to work with a new client is the pilot is just as much work to set up and implement as a full service. And so with health systems, what we've done really effectively is work within departments and treat those as almost like different customers. Even though it's part of the health system, you're going to do different activities to implement within internal medicine than you are with cardiology or than you would with rheumatology or endocrinology. So we try to treat each specialty within a health system a little bit differently with a cohesive plan in each department. And we might start that with a certain specialty or department or location. Just always a health system will have that clinic or those people that are usually the ones to try something new. And so that's where we try to start or ask. And if they want to call that a pilot, that's fine. But at the same time, just going with just a few patients and rolling it out with just a few providers actually doesn't usually equal more success. It just draws out the program a little bit longer. And the work to prop it up and to implement these programs is just the same as if you went with a whole site or specialty at the same time. And then when we do that, we can actually not only connect CCM, RPM, transitional or principal care management, but we can connect transitional care management. So post-discharge, getting those patients either enrolled or set up with devices for remote patient monitoring. And now we can connect the dots between discharge and the ambulatory outpatient centers. And that's where we can be most effective within a health system.
Yeah, that's super interesting because we do see health systems when they talk to us, they do want to start small. They do want to start with a certain department and fewer patients. But it makes sense that if you're spending time and money starting in a smaller group, might as well start across various departments. But yet it probably depends on the appetite that the health systems have to start a new program across multiple departments. I'm sure that can be challenging as well.
For sure. I mean, they usually have their targeted sites that they try new things with, and that's where we want to start as well.
So what are some of the programs, if you're able to provide examples of what the health systems are actually utilizing, maybe in terms of what conditions or type of implementations?
Yeah, so what's really helpful is that we're integrated with all of the main electronic EMR systems. And so with that the bulk of the implementation and getting started is usually propping up that integration, right? So it's really important to have that integration team that's either internal with the health system or external with the EMR that they're using be on board from day one, and we scope out that project. Because having that integration will help not only the services down the road, but it's going to help when we enroll patients and start new services within different departments. That integration is what allows us to scale really quickly. And I mentioned it earlier, we have the core remote patient monitoring and chronic care management, but within health systems, transitional care management and post-discharge, either from the hospital or through a SNF, has been really important to prop these programs up, right? So we can not only be in a fee-for-service world, but now we're in also a value-based world with transitional care management, preventing hospitalizations, preventing readmissions, and we can connect those dots right off the bat and show value right off the bat as well.
So given your history and all the experience that you have with working with clients, and you've seen the evolution of remote care management, what are some of the mistakes or pitfalls that you see health systems doing that they should avoid? You've already mentioned one where they start with pilot programs. What else can be a learning point for them?
Sure. Yeah, I think the biggest thing is that we've had a lot of success doing multiple programs at the same time, rolling out just chronic care management with one department or just remote patient monitoring, possibly with cardiology. Like those programs work on their own, but you really do get a synergistic effect when you add CCM and RPM. Those programs together prop up both of them separately and better. What we've seen is patients that are in both programs actually are more engaged, take their vitals more regularly if they're also in chronic care management, participate in health coaching, and are engaged more if they have a device in the home that they're taking vitals. So I think one of the other misconceptions is that we are just going to start CCM right now, or we're just going to start remote patient monitoring right now, and let patients choose and let the providers choose if patients need to be in both programs or one or the other, because it'll make that overall program much more successful if we can give patients options and also give you the providers options as well.
So in those examples where clients have actually utilized multiple programs at once and possibly have seen some ROI come in, can you share a few examples of the types of clients or how many patients they've enrolled and what outcomes or ROI value benefits that they've seen?
Yeah, in working with Panda Health, your clients are health systems, so I'll put that in perspective just from a health system point of view. Is we've been involved in a lot of integration projects, but also we're using this EMR in our health system, and now we're moving to a different one. And those can be a little bit more complex as well. And what we've seen is if we do it the right way from the start, from an implementation standpoint, and make sure that the right people are working with us for that launch, we're much more successful. So having someone from billing, having that integration team, part of the the launch from the start, along with a site managers, outpatient center managers, and also clinicians to sign off on protocols. So in the specific case of a large health system in Memphis, we've gone from their transition from one EMR to the other. They had different EMR in the outpatient centers, and then another EMR in the inpatient in the hospitals, and then working on that conversion to one connecting dots. Then we're able to then launch an enrollment campaign for their eligible patients that want to opt in. And then we're also able to, at the same time, to implement a transitional care management program for discharges. So now we're propping up the program and enrollments in two different fashions from two different quote unquote pipelines that are going to make the program successful. And in those cases, we're usually able to enroll. Our average is around 30 to 35% of patients that are eligible that come through, we're able to enroll. And then that education on site can prop that up another 10 to 15% if we have people enrolling patients during their visits at the outpatient clinics, and also have people helping to enroll during transitional care management and discussions with the patient post-discharge. So having those two streams has been key for us to have results within health systems. We're helping connect the dots within the system, and then we're also working on two different programs, one that's looked at more for fee-for-service in the outpatient centers, and helping facilitate one that's more value-based within the health system. It's through the inpatient centers themselves.
Yeah, that's fantastic that you offer that flexibility and are able to work across different situations within health systems. We've spoken a lot about how health systems can adopt these programs and see outcomes. But for some health system where they have been using remote care programs already, what do you see is next? What is next in remote care in general and at MDRs specifically?
Yeah, in 2016 to 19, it was a lot of phone calling for chronic care management. There were a lot of Bluetooth devices out there in the market. A lot of times you had to use a smartphone in order to interact with the patient for vitals monitoring. And that technology has really evolved over the years. And so we're seeing more and more each month, more Medicare-aged patients being comfortable with digital engagement, like text messaging, using an app back and forth, logging their own activities within an app or on a phone. And those are the really engaged patients that wouldn't have necessarily done well with just a phone call or just vitals inside their home. So we're actually able to offer an enhanced experience as patients get more and more comfortable using smartphones and technology. And then from the flip side perspective, we're seeing new devices on the market as well. So we're now integrated with with the two main continuous glucose monitoring devices that are on the market. And again, as patients get more comfortable with these technologies, we have to adapt to them as well. So that allows us to get more and more engagement, create value for the patient, but also value for the providers as well. We can use predictive analysis to then, based on the patient's trends from a CGM device, we can predict then how certain diets, foods, activities will actually affect their glucose levels throughout the day. And so when you provide that kind of value, now you have a program that was maybe in 2016 was just health coaching and calling people from the phone. Now you're getting all these extra interactions. Patients are more engaged. They know what the program is and they're using it on a more regular basis. So we're now bumped into 2024 where you have to provide these types of options and services for the patient, but also for the providers. They get a better background and better information from how they should treat their patients. And that was the original goal for CCM when these codes were first approved, and I think we are getting to that at a much higher level, especially in the last 2 to 3 years.
Yeah, that's exciting, and I believe you were referring to Dexcom as one of those partners, right?
Yeah, Dexcom and Libre, both of the continuous glucose monitors that are on the market provide a lot of valuable information for us to help talk to the patient, but also provide good, healthy living and patient-centered goals that they actually contribute to themselves, and we try not to talk about necessarily symptoms or how to treat their chronic condition, but how do you help them in their daily living, and also what are their goals that they want to do? So those are usually lifestyle goals, not numbers. And that's really what we've tried to focus on, is more of a health coaching and lifestyle coaching, and make it patient-centered.
Yeah, that's a fantastic, because it's more collaborative with the patient, using the real-time data. You're doing both coaching, using insights, rather than, like you referred several years ago, it was just coaching and hoping that the patient complies with it.
Right, or hoping they pick up the phone, right?
Yeah,
So
exactly.
we're building really intimate relationships with our patients.
That's fantastic. That all sounds so exciting. Anything else that you'd like to add or share about MD Revolution?
No, I'm really excited that we got to talk, and we're really excited about our partnership. And obviously, health systems are a great opportunity to affect a lot of lives. It typically takes a lot longer to get our initiatives through and work with the health systems, but we have several that we've been very successful with, and we're excited to expand to more.
That's fantastic. Thank you so much for your time, Paul.
Thank you.
Thank you.